Disease prevention is a major social issue due to the rise of preventable illnesses, addictions, and sedentary lifestyles. While families influence personal habits, today's health challenges require broader action. The government holds the main responsibility because it can implement large-scale measures such as vaccination programs, food regulations, workplace safety standards, and public health campaigns. These actions protect millions of people at once, something individuals cannot achieve alone. However, individuals and families also play an important role. They can adapt healthy routines, avoid sedentary behavior, seek medical checkups, and stay informed. Still, these choices are more effective when supported by government education and accessible healthcare services. In conclusion, both sides contribute but the government must lead, providing the policies and systems that help people make healthier decisions.
My essay argues that disease prevention is a shared responsibility, but that the government must take the lead. I explain that the governments have the resources and authority to organize large-scale programs such as vaccination campaigns, sanitation systems, and public health education. I also mentioned that individuals must maintain healthy habits and avoid harmful behaviors. But these decisions are strongly influenced by socioeconomic conditions. Therefore, without proper policies and infrastructure, people cannot protect themselves effectively. After reviewing both essays, we found some similarities and differences in our viewpoints about disease prevention. The similarities are that both essays agree that the government plays a primary role in disease prevention. For example, both mention that only the government can run mass vaccination programs and create regulations that protect entire populations. Similarly, both essays highlight that individuals and families still contribute by maintaining healthy habits and making responsible decisions. Now let's go with the differences. However, one difference between the essays is the emphasis on social inequality. I argue that the personal decisions are deeply limited by socioeconomic conditions, whereas my teammate Amaury focuses more on the government capacity to guide public health but mentions inequality only indirectly. In other words, I place more weight on the challenges that poor family faces, while my teammate emphasizes the importance of government structure and policies. Now let's talk about why these perspectives exist. These perspectives exist because we approach the problem from slightly different angles. I consider how poverty and social context affect personal choices, which may come from observing real situations where families struggle to access healthcare. And on the other hand, Amaury focused more on research about public health systems and the large-scale impact of government decisions. Even though our experiences and points of emphasis differ, both perspectives show that the government action and individual responsibility must work together. In conclusion, while individual actions matter, government leadership is essential for effective disease prevention. Our essays share the same main idea, but we approach the issue from slightly different viewpoints based on our experiences and focus areas, and also from what we research in order to get into this conclusion, but we can see that we have like the same main idea. Thank you.